Hello, everyone, and welcome to HeadWise, the videocast and podcast of the National Headache Foundation. I'm Dr. Lindsay Weitzel. I'm the founder of Migraine Nation, and I have a history of chronic and daily migraine that began at the age of 4. We have a super exciting and unique episode today. I am here with Dr. Joanna Kempner. Hello, Dr. Kempner, how are you?
Great, thank you so much for having me.
Dr. Kempner is an associate professor of sociology at Rutgers University, and she is the author of 2 books related to migraine. The first one was called Not Tonight, Migraine in the Politics of Gender and Health. The second is called Psychedelic Outlaws, the Movement Revolutionizing Modern Medicine. And I have my copy right here. It's a great book, and you should go look for it on Amazon, but we're going to talk all about it today. Dr. Kempner writes a lot about medical sociology and how it relates to headache, and she is such a great writer, and I can't wait to hear everything she has to say to us today. So thank you for being here again, and I would just love it if you could start by talking to us a little bit about why you work in this field and why you chose to write this book.
So I've been working in this field most of my career, which some people find odd because I'm a sociologist, not in healthcare. But I wrote this specific book because I found it to be a really powerful and hopeful story. But let me back up, because I too have had migraine my whole life, and I don't remember a life without migraine. My mom says that I started getting severe headaches when I was about 5, and she took me to a pediatrician who said that I had a type A personality and said that there was nothing that could be done. It's ridiculous. What's ridiculous about it is, if you know me, I definitely don't have a type A personality. And my mom also has had migraine her whole life. I come from a migraine-y family, both sides. Everyone, we just all have migraines. And she had heard that nothing could be done. She had heard it was all in her head her whole life, and she just wasn't going to have it for me. That was not going to happen. So I had the good fortune of growing up in a house with a family who believed me, even if I experienced stigma and gaslighting everywhere else.
Right.
When I went to graduate school for sociology, I wanted to study gender, maybe reproductive policy, something like that. But I got really interested, especially, this is 25 years ago, in bias in medicine. And what doesn't get studied. I wanted to know what wasn't being studied, particularly around women in health, which is a big topic back then. It's really hard to study ignorance, but my personal experience came in so handy, because if you have migraine, you know about ignorance, right? And it gave me this idea that I could study moments where intense suffering is met with a dismissive, nothing's wrong with you. And that's a really powerful way to find out what medicine doesn't know, really listening to patients. By the time I was done writing Not Tonight, which is all about migraine and stigma and this question of why we don't know more about migraine, I had met Bob Wold, who is the founder and executive director of Cluster Busters, which is this patient advocacy organization in cluster headache. I loved what they were doing, in large part because I had just spent all of these years listening to people in headache medicine tell me they wanted to do more research in headache, but there wasn't enough funding. Or there wasn't enough people who were interested in headache. And I had also been doing work elsewhere in forbidden knowledge. I've been listening a lot to the news around political suppression of science. And I basically had just grown very tired and depressed about scientists telling me they couldn't do work. Went to Cluster Busters meeting, and what I saw were people in pain doing the research themselves. They weren't going to take no for an answer. And they weren't just doing any research, they were doing research on psychedelics, which is, of course, illegal. And I was like, wow, this is resistance. This is hope. These are people who are brave, they're innovative, they're creative, and I want to know more about what it is they're doing.
For anyone in our audience who does not really know what cluster headache is, can you explain what it's like for someone suffering from it so that we understand how desperate these people were to find a means to help themselves?
Yeah, it's so hard to understand somebody else's pain. And so when I went to a Cluster Busters meeting, I was like, oh, I get it. But I
Mhm.
really didn't. I really didn't. And I don't like to play pain Olympics because living in chronic migraine pain is awful. What an awful
Yeah.
life, right? So cluster headache is the diagnostic cousin to migraine.
Mhm.
They are shorter lasting pain. They
Mhm.
last between 15 minutes to 180 minutes, but you can
Right.
have more than one a day. They occur on one side of the head and they are very, very severe. So what people describe them as is it's like a hot iron being jammed into your eye. The intensity is brutal. On a scale of 1 to 10, a cluster headache might be like a 9.7 and a migraine
Mhm.
would be about a 5. This comes from a study of 1,300 people. And then with that cluster headache, there is also a kind of different set of autonomic symptoms. So eye tearing, your nose would be pouring. And instead of going into a dark room and retreating into bed, people tend to get really agitated, really active. They might even try and bang their head against the wall, try and get the pain out of their head. It's
Mhm.
called the suicide headache because unfortunately there's quite a lot of suicidal ideation during these
Mhm.
attacks, and suicide attempts and actual suicides are much more frequent in this population.
And I believe it's known as the highest amount of pain known to man. When they question people, they say it's worse than childbirth without medicines, without an epidural, it's worse than gunshot wounds, etc. So it's touted as the worst pain that known to mankind.
So one of the things that people with cluster headache explain is that when you experience these other really severe forms of pain, your body usually goes into shock
Mhm.
or you have some kind of hormone release, but that doesn't happen with cluster headache. The way I've learned to think about it is that every attack is a severe medical emergency.
Mhm.
It's like giving birth every for that amount of time, with every period. So the reason I think that is so important is because people are really scared and you can see it in their eyes.
Mhm.
I think it's almost a hallmark of the people I've met is that they're really terrified of this
Right.
next attack. I think that matters when you're trying to think about the motivation behind doing something like breaking the law or experimenting in this way, because the motivation is so high. And then the
Right.
other thing I just want to mention about it is there's far less research about cluster headache. There's not a lot of research on migraine. It's very hard to get care for migraine,
Right.
particularly chronic migraine. That's good, but for cluster headache, it's even harder. So it's they're using off-label drugs. They're running out of Imitrex much faster than people with cluster headache. With migraine, and
Mhm.
so the desperation level is really, really high.
Let's go on to how was it discovered that magic mushrooms or psilocybin might help people with cluster headache?
So the patient movement launches, you can trace it back to a support forum, a patient support forum in
Mhm.
1998. So in a lot of ways, this is a history of the internet.
Yeah.
And if you've ever been, I know you've been on a patient support forum,
Right.
and so many of us rely on them. In 1998, more and more of these forums are starting, and that was when the first cluster headache forum starts. And about 2 months into its formation, a guy who goes by the name of Flash posted a message saying that he used LSD and magic mushrooms to prevent his cluster headache cycles. Everybody was like, okay, whatever. Just sort of ignored him because honestly, people were putting all kinds of ideas about their
Mhm.
cluster headache on there. The internet is what the internet is.
Right.
um, but every few months, he would post a little bit more information about what was happening. He would post some research on it. The internet was making it easier than ever to find research and science and to reach out also to doctors. Doctors hadn't yet learned to hide their emails. So you
Mm.
could email neurologists, and neurologists were essentially confirming that psychedelics could actually treat cluster headache. So some of this research they found was really compelling. It turns out that Albert Hoffman, the chemist who discovered LSD,
Mhm.
was also a really, really important chemist in the discovery of headache medicines. Sandoz, the pharmaceutical company where he worked, his boss, Arthur Stoll, had discovered ergotamine in 1918. And in 1925, that becomes one of the most important migraine medicines there is. Albert Hoffman, in 1943, which happens to be the same year that he discovers LSD is psychoactive, he creates DHE. Most people don't know. I mean, Albert Hofmann's kind of an icon in psychedelia. Most people don't know that he also created these important migraine drugs. Those drugs and LSD have really similar structures, chemical structures, and those chemical structures look a lot like serotonin. So they interact really strongly with serotonin. In 1959, so that's 1943, 1959, Federico Secretari, who was a neurologist, an Italian neurologist who ran a headache clinic in Florence, and who's credited with the discovery of the serotonin model of migraine, started giving some of his migraine patients LSD, and they were coming back saying their migraines were disappearing. And that led to the discovery of another Albert Hofmann creation, a drug called methasergide. Methasergide is an LSD congener, so a non-hallucinogenic version of LSD. And that was sold by Sansert. I'm sorry, that was sold as Sansert as a migraine and cluster headache preventive for years. It was only taken off the market in 2002. Imitrex, sumatriptan, which many of us use, is part of this intellectual tradition. So all of this information is coming out now online, and people are talking about it because he's making a compelling case. And then by early 2000, finally somebody tries it. It takes a while. Somebody tries it and it works. And then somebody else tries it and it works. By the end of 2002, so many people are doing this on the forum, and so many people are reporting strong results that essentially they get kicked off that forum. And Bob Wold is like, you know what, we need our own private space. And he creates Cluster Busters, which is really just a Yahoo discussion forum. And what they do is they decide that they're the people who really, really want to try this are going to come up with their own drug protocol. And they do that in about a year, just through self-experimentation. So that's how it happens. It's a combination of, it's really self-experimentation and the internet connecting just regular patients with this science. The interesting thing is every time they talk to anybody in headache medicine, that person would say, makes sense, because they all knew this history.
So this is probably a good time to explain, in case people are wondering, because there's so much stigma around psychedelics, etc. The protocol that Cluster Busters and other people doing this did come up with, and that's often used in these instances, it does not necessarily involve hallucinating. Is that correct?
Well, it does a little bit, but it's not like the stories that you're hearing in the news around, PTSD or depression, where people are, doctors are giving very large, what's called heroic doses of psychedelics, and you have to see God and change your mind or anything like that. The dose that they find effective is small, not a microdose, not necessarily subhallucinogenic, although that does work for some people. It tends to be a little bit hallucinogenic. And by a little bit hallucinogenic, I mean the colors in the room might get brighter. You might laugh. You might see the walls, what it calls breathe a little bit. You're definitely going to know that you're on something, but you're not going to, reality isn't going to disintegrate. You're not going to forget that you are a person. And the protocol that they developed, the one that they think works the best, is to take 3 doses in about 11, 5 days apart. So about 11-day period. Like any protocol, that gets tweaked a little bit.
Why do you think there is so little research on cluster headache or all these things that we're talking about? Why do patients have to go figure all this out on their own?
The first, I mean, it's the worst pain known for people to experience. And it's medicine's job to stop suffering. So in a way, that's very puzzling. Now, I know from all my research, I mean, my first book was all about why don't we know more about migraine, given how prevalent and disabling it is. And my answer was really stigma and gender. I thought that, because cluster headache is a small, rare disease within the umbrella of migraine, that it was just artifact of this. But there's something else going on here that I think is really important. Cluster headache itself has a lot of randomness as a disease. Some people can predict the onset of their cycle, but for a trial to work, in a randomized controlled trial to work, and randomized controlled trials are the gold standard of medical research, you generally have to have cycles that are at least 6 weeks long. And you have to also be able to get people who are willing to have a placebo control right?
Yeah.
And this is the worst pain in the world. It's also a rare disease. So you're going to also have to be able to recruit enough people into clinics.
Mhm.
And this is all really difficult, right? So even companies who have a lot of money, like big pharmaceutical companies, when they have a drug they think is going to work, it's really hard to recruit the numbers
Right.
necessary to get what's called statistical significance. So the disease itself doesn't lend itself to the research method that the FDA prefers.
Very good answer. That was more in depth than I was thinking. I was thinking it was going to be an answer related to stigma, etc. But that is a very good point. As someone who used to do clinical research, it would be difficult to do that. So can you tell us?
I'm sorry, can I just add?
No, go
Imagine
ahead.
how much
Sorry.
more difficult it is if you're
Yeah.
studying a drug that you can grow in your closet.
Right. Right. So why go, make another medicine if there's something in your closet
Well,
that's working?
first to get investment in a drug
Right.
that can't be patented, so the
Mm-hmm.
funding is difficult, but also to convince people to enroll in a study that is placebo controlled when they could just grow the medicine.
Right.
So it is a very challenging research project and
Interesting.
something that it's what I call regulatory ignorance, right? It's like we have a drug system that isn't really working for patients.
So, what can people with other invisible or stigmatized conditions like migraine or chronic pain take away from your book, Psychedelic Outlaws?
Well, I think that reading about people in pain who are so often painted with so much stigma and characterized as people with so much, as drug seekers,
Mhm.
looking at how innovative and creative and brave this group of people are in tackling their care and really understanding the social, cultural, and like legislative factors, the rules that force people to break the law, and then watch how clever they are in bringing this protocol all the way up to Harvard and Yale. I
Mhm.
found it, I'm a person who has hard to treat disorders, and I don't like to study things I find boring. It's an inspiring story, but it's
Mhm.
also an infuriating story because what happens is the narrative is inverted. So these people, I call outlaws, it's like outlaws with a wink, because
Uh-huh.
these are not people you would necessarily think. These are not people who are into psychedelics. They're just
Right.
people who want to be out of pain. And then but they keep running into people in academia who are treating them poorly. I think it really can, for those of us who sometimes feel like we know more than our doctors,
Mhm.
I think this is a story that we can relate to, but we can also start to understand how we got to this place. I hope that people can read this and start to see the history of how medicine developed and start to understand why it's so frustrating sometimes to get care.
What was the most surprising thing you learned while researching and writing this?
Well, I started writing this book as thinking like the mushroom is the hero. I even have a mushroom lamp. But actually, it's the patients coming together in support groups
Right.
that I think are the hero. Like
Mhm.
it's the support that matters. That's where I came out in the end, that it's networks of care, it's being heard, it's being legitimated that makes the difference.
Mhm.
Headache is a really complicated disease to treat. And anybody who's gone through the process of the frustrating process of getting treatment knows that going to somebody who has a lot of tools in their bag is the best
Mhm.
thing
Yeah.
possible, right? And
Yeah.
treatments, even when they work, often fail. But you need a lot of support. And so that surprised me. I didn't think I would come out of this thinking, actually, what you really need to do is you need to find your people.
I like that you said that. It's very true. It's so often that, working together and finding each other in these social support groups, et cetera, that we learn what we need to know. In your research, is there one story that stood out?
I'm going to flip this question around a little bit to talk about the story I didn't find. Almost everybody I spoke with was white. Finding people with cluster headache who were Black was difficult. Finding somebody who would talk to me who had cluster headache who treated themselves with a psychedelic was even harder.
Hmm.
And this, in many ways, reflects the stigma, not just of cluster headache, but also of using an illicit drug. The Black community in polling shows, there's much less use of hallucinogens than any other race and ethnic group. The people I spoke to of color in my sample had really unusual, very different experiences. So one of the people I call her Bernice Clark, said, as many people with cluster headache do, she had a lot of trouble getting diagnosed. And she was told that she couldn't possibly have cluster headache because women don't get clusters. That's a common myth. And number two, Blacks don't get clusters. And of course, this is not true, but it is, they're both common myths in the literature and in clinical practice. Another person I spoke with, Andy Berry, told me that when he had cluster headache, he tended to isolate, which is fairly common for people with cluster headache because of the kind of agitated behavior. But what he said, what he added was that he was really frightened of the police seeing him have an attack because of police brutality. Now, those two comments made me think about the absences, what I wasn't seeing, what I wasn't hearing, and what I wasn't talking. So I'm going to take a cue from this. There's a historian called Sadia Hartman who studies slavery, and she talks about looking at what's omitted in the archive. And if you really want to understand marginalized experiences, you have to use your imagination because those voices aren't represented. And I'm beginning to tire of the idea that we can't know what goes unsaid, because we do know something about what it means to be undiagnosed with brutal pain. And that's actually what haunts me. It's about who I didn't see getting help.
That was a great answer. Thank you for that answer. I thought you were going to come up with one of the leaders of one of our nonprofits or something, but that was
Well, they're great too.
Yeah,
they're great
no,
too,
that
but
was,
we can go and look and talk to them.
right. That was an answer I was not expecting. So thank you for that. There is a quote. My last question for you. I'm so curious what you're going to say to this. Bob Bold, the founder of Cluster Busters, in your book, you have a quote from him, and it says, "You cannot introduce transformative medicine into a broken healthcare system." From your perspective, after writing Psychedelic Outlaws, how is our healthcare system broken?
Well, there's the access issue, of course, right? We live in the only developed country that doesn't have full access. We don't have enough headache specialists. Cluster headache is a disease that really does require a headache specialist. And sometimes it requires a headache specialist with knowledge of cluster headache. This is like an extreme story of that lack of access. But again, like, I think it's really relatable. That frustration you feel when you just keep going to the doctor with something wrong and they keep telling you something and you just know it's the wrong diagnosis. I have great insurance, I have great access, but it's still really difficult to find a doctor who understands what's wrong with me, and even to piece together care from all of these different specialists. And so what do? I go online. And but the thing is I wrote this book during the pandemic when people were going online because they didn't trust what their doctor said, and they were coming up with all kinds of wild treatments.
Right.
And so I was writing a book about people who I thought were doing amazing work, while trust in healthcare and experts is at an all-time low. In addition to access, we also have this trust problem. People don't know who the experts are anymore. They don't know, especially when you have complicated health problems, right? So who are we supposed to listen to? Yeah, we got to work that out. We got to work out, like, how do you figure out where to get information from? Credentials are supposed to solve that problem. You're supposed to be able to trust your MD. You're supposed to be able to trust the FDA. But people don't, and they don't for reasonable reasons, right? They don't because they see scandals with that do occur. They don't because they're not getting good care. So we have to solve that problem as well. And then there's just the regular cost of drugs and getting that medication and getting, and being able to take off of work when you need to in order to get these treatments. Bob Wold, he has experienced the whole gamut of this. One of the things he's pointed out is, like, it doesn't, like, we could get this effective treatment into medicine, but he's been struggling to get people diagnoses. He's been struggling to get people high flow oxygen, which is also a great treatment for cluster headache. So what good is an effective treatment if you can't get these things? What good is a miracle treatment if the insurance company isn't going to cover its cost?
Right.
And, so we have real work to do with this system. I think it is so easy to think that a pill or a mushroom is going to save the day. The best thing about the mushroom is that you can grow it at home, but there are still these fundamental inequalities, these fundamental problems with healthcare that need to be solved. So, and he really sees that, I think, and that's at the end of the day, we just have a lot of work to do.
So I always like to end with the question, is there anything you'd like to add before we go? Did we miss anything that you think is important to add to this story?
I think so. I hope that people reach out and find support, because I've really seen how much, networks of care do transform people's lives.
Yes, they do. Well, thank you so much for being with us and for talking about this amazing story and your new book. And thank you everyone for listening. And please tune in again for the next episode of HeadWise. Everyone have a great and pain-free day.